when it's your turn. Now, with all the boring housekeeping details out of the way, I am happy to introduce today's expert, Dr. Liana Rosenthal. Dr. Rosenthal is an associate professor in the Department of Neurology at Johns Hopkins University School of Medicine in Baltimore, Maryland. She completed medical school at Johns Hopkins with an internship at Johns Hopkins Bayview Medical Center. She completed her neurology residency and movement disorder fellowship at the Johns Hopkins Hospital and is board certified in psychiatry and neurology. Dr. Rosenthal is also the director of the Johns Hopkins Ataxia Center, and she's a medical director here at NAF on our medical research and advisory board. Welcome, Dr. Rosenthal, and thank you so much for joining us today.
Thank you so much for having me. It is an absolute pleasure to be here, and I'm looking forward to an exciting and hopefully interesting session. If I am explaining an answer to a question and it's not making sense to you, please raise your hand or put it in the chat. I will obviously do my best to make sure that everyone can hear me, first of all, in terms of technology. And second of all, that I'm explaining things in a way that makes sense, because the whole point of this session is really for you and to answer your questions. So with that in mind, there were some questions that were submitted in advance, as Steph already said. And so I'm going to answer one or two of those as we wait for questions to come in from you guys right now. So a couple of the questions that came in focused on what I would characterize as sort of alternative therapies. So one person asked about something called a BEMER, B-E-M-E-R, pulse electromagnetic field device. Another person asked about something called G therapy, which is apparently a homeopathic Ayurvedic remedy. And so I'm just going to give kind of a framework for how to think about and how I think about these complementary and alternative therapies. There is so much we don't know about medicine. There's a lot we do know, but there's so much we don't know. And so when you're looking at all of these different complementary therapies out there, I would encourage you to think in terms of the following. First, is this really expensive? Actually, back up. First, is this going to hurt me? That's really the first thing. Is this going to cause a problem? Is it going to do any harm? That would be the first thing. Second, does it have the potential to help me? So is it going to hurt me? Does it have the potential to help me? And if it does have the potential to help me, how much is it going to cost? Both in terms of my time and in terms of actual financial costs. Because some of these complementary therapies can be wonderful. So, there's massage can be wonderful for sore spastic muscles. It can be great. It is not going to hurt you. It may or may not help you in the long run, but it certainly is going to feel good. And it tends to be reasonably cost. So that would be an example of a complementary therapy and sort of how I think about it. I can give you another example of a complementary therapy in the context of stem cells, which always comes up. And there's good evidence that stem cells have the potential to help in the long run. At this time right now, I would strongly suggest to people that they not engage in any of these stem cell therapies outside of a research study. So if there's a research study that is going on in the US or Canada or Europe, I would say by all means, if you're interested in that research study and it is a stem cell treatment and you believe it is safe and they explain the risk and benefit to you, that makes sense to me. But in terms of flying to China and getting stem cell therapy, or there's some places in the US where you can get stem cells infused into your spine. In my mind, that goes under the category of it can hurt you. And therefore, I wouldn't do that. In addition to the fact that it's going to cost you a lot of money. And so that's how I sort of think about these complementary therapies. Can they help? Is it have the potential to hurt you? Because you don't want to cause yourself any more problems. And how much is it really going to cost, both in terms of time and money? So that's how I sort of think about these things. And there's a lot of them. I haven't heard of necessarily the BEMER therapy. I haven't heard of the G therapy, but just because I haven't heard of it doesn't mean it doesn't have the potential to be good for you, as long as it doesn't hurt you and doesn't cost too much in terms of your time and money. So with that stuff, it looks like we have some questions coming in.
That we do. First one I saw was from Karen. She said, are there any supplements that the doctor advises for her ataxia patients?
So supplements, generally no, if you are eating and able to eat a well-balanced diet. So assuming you can eat, these days it's a food plate with the right amount of fruits and vegetables and things like that. Generally no. Some people's primary care doctors will recommend different supplements, fish oil, CoQ10, that kind of stuff. But at this point, there's really no evidence that they help in folks who have ataxia. And so I have not been recommending them. Certainly some people swear by certain supplements, and if it makes them feel better and it's not too expensive and the pill isn't too big to swallow, then I don't have a problem with it, really. But it's just a matter of there isn't any supplement that I would recommend at this time. Do you want to pull more questions from the chat?
Sure. We actually do have a hand raised. So
Sure.
Eileen, I'm going to unmute you. And then you should get a pop-up on your screen. If she's still there. And she might.
Oh,
there we
she unmuted. Yeah.
Eileen, are you there?
Yes, I'm here with my husband.
Perfect.
He is the one with the cerebellar ataxia, and he has some questions for you.
Okay.
Sometimes his speech is very garbled.
Hello, Dr. Russell.
Hello, how are you?
Hi, I'm good. Have you heard of
Frankincense.
a drink called Frequency?
A drink called Frequency?
Yeah, it's made out of plankton from the ocean.
I was just reading about something along those lines recently, but now I haven't heard about that particular one. But I did see that people were now drinking different drinks like that. I haven't heard of that particular one though. Is it, if I can try looking it up while we talk, do you have a specific question about whether or not it's something that would help you? Is that your question?
I was diagnosed in 98, and in 2002, I started taking it. But this past year, the ataxia is really starting to get me. And I had a coworker who asked me about stem cell rejuvenation. And so I'm trying it, but I don't think it's working.
I'm sorry it's not, but it unfortunately doesn't surprise me. And I'm sorry it's not working. I wish it did, and I wish it were. The problem with the stem cells is that these days what they're doing is my understanding of what you're getting are just these cells put into your spinal fluid with no particular location or details. And unfortunately, that's not what's needed when it comes to stem cells. So unfortunately, there really needs to be more research done, and it really needs to be more targeted than what we're able to offer sort of, commercially. And so there's some, interesting research looking at stem cells and some interesting research looking at gene therapies. And I think those have the potential, but right now we're really far from prime time on both of those things, unfortunately.
Okay, I thank you for your time.
You're welcome. And I'm sorry, I wish we had more to offer.
Oh, that's okay. My mom died at 85 with what I have.
Okay. So, well, good luck to you, okay?
Thank you.
You're welcome. I can go back and look at some of the other questions that came in before today.
Yeah, let's do that.
There were a couple of questions about the anesthesia and surgery in the setting of someone who has ataxia. So I have a number of patients who, for a variety of different reasons, need to have surgery and also have ataxia. And the main things would be that recovery will likely be a little bit slower. In the magnitude of, if it takes most people, 3 or 4 hours in recovery, it might take someone with ataxia 4 or 5 hours, a little bit longer than that. Because whenever you recover from anesthesia, your balance is always a little bit off. And then you add the ataxia on top of that, it's certainly going to be very off. If someone who has ataxia is also having cognitive problems or swallowing problems and things like that, again, the recovery time is just longer. So if the doc says, oh, you'll feel better within a day or two, I would assume that one of my patients with ataxia is going to feel better within, 3 or 4 days instead of that 1 or 2 days. That is the usual recovery time. But certainly I would, you have to let the anesthesiologist and surgeon know that you have ataxia. If you are having any swallowing problems, making them aware of that. But otherwise, there really shouldn't be anything else that you need to arrange for, other than actually one other thing, slightly longer time, if you can, in the post-anesthesia recovery unit, to give yourself that time to have your balance be improved, if that makes sense. But otherwise, there's certainly, if you need surgery, you need surgery. And by all means, then it makes sense to get it done, just as long as the surgeon and anesthesiologist are aware. Talk with also your ataxia doctor, so whoever's following you for your ataxia, because they may also have some specific things related to you and your care. But generally, I advise my patients, and I talk with their surgeons and anesthesiologists sometimes, and people really do just fine, and they do very well post anesthesia and post surgery. Seth, do you want to ask a few more questions, either from the chat or hand raising?
We have a couple hands up and some stuff coming in the chat. So why don't we do one from the chat, then we'll call on one of the people with their hands up.
Perfect.
From the chat, can you inherit less repeats than your parent with SCA had?
Yes. This actually also relates to one of the questions that was sent in advance. There can be some instability in the number of repeats. Usually, the number of repeats, if it's going to change, it increases. Sometimes it doesn't change. It depends on which SCA someone has. Some of the SCAs are known to have more and more repeats in each generation. Some of the SCAs are known to have stable repeats in each generation. And certainly there can be situations where people have a slightly less repeats in each generation as well. So there can be this instability. One of the questions from the chat that ties in was a question about why is it that with each generation, the disease was coming earlier and earlier and more severe. And the reason that's happening most likely is that with each generation, the number of repeats is getting bigger and bigger. And the more repeats you have, the earlier your disease starts. And we believe also to a certain extent, the faster it progresses. So that's why that's happening. But there can be this instability. Usually the number of repeats goes up, not down, but it can go down.
All right. And then Jill has her hand raised. So Jill, I'm going to ask to unmute you. You should get a pop-up on your screen.
Okay. Thank you, doctor, for doing this, because I don't really have too much information or support groups where I live. I live outside of Philadelphia in South Jersey, and I don't really know anybody that has what I have. And my question to you is, I actually realized after I gave birth to my son, I didn't have problems going down the stairs, walking down the stairs. So I realized this and I went to a neurologist, and that's when they did an MRI of my brain and they saw that I have cerebellum ataxia.
Mhm.
So to you, I mean, I also have depression too, and I'm taking medication for that. So I don't know, like everyone's telling me different sides. I have a neurologist and a psychiatrist, like basically giving medication for my depression that might affect my ataxia. Like what do you recommend in that instance?
So the medications are given for depression, most of them do not negatively impact balance. There's a few, there's Depakote, there's a couple others that are, those that can be sometimes given that can impact balance. But generally, what I would actually strongly encourage to everyone is that treatment of depression and anxiety is actually very high on my list of things that you should do for your ataxia. And that treatment of your depression and anxiety will actually help you, with your ataxia. So without knowing the details of the medications, it's hard for me to delve too deeply. But what I know for sure is that people who are depressed or anxious have more symptoms and do worse than people who don't. And this whole idea is, how can we help your quality of life? And if you're feeling depressed and anxious, then that is a lower quality of life than if you are not feeling depressed and anxious, number one. And number two, we actually also believe that the cerebellar ataxia itself is likely the cause of or contributing to your depression. And not just because, I have cerebellar ataxia, of course I'm depressed kind of thing, but the neural circuitry itself. So the changes in the cerebellum changes the way the cerebellum interacts with the rest of the brain. And when that change and how things are then adjusted, in turn, can cause problems with mood in terms of irritability, anxiety, and depression. And so I would actually say that the two are probably related, that you absolutely need to have your depression and anxiety treated. The devil's in the details in terms of which meds, but I would certainly encourage you to work with a psychiatrist and neurologist who are sort of on board. If you're near Philadelphia, there is a new ataxia physician at Penn, whose name I'm now forgetting, and I know other people on this call know his name. And certainly you're also welcome to come down and see us at Hopkins as well, if that'd be helpful. I know we have support groups down at Hopkins, and then there's also a support group up in Philadelphia area in Pennsylvania that is run by a wonderful gentleman. And so I would encourage you to get in touch with those groups. And there's certainly also, a number of people I'm seeing here over Zoom, and I also know some of my patients who are also young women, mothers with ataxia, that you can try to get in touch with as well. So I would encourage you to reach out to all those resources, because we definitely have resources in your area. You're in a place where there's definitely a lot of ataxia doctors within a couple-hour drive.
And then, I think she's muted again.
Yeah. Oh, you're still muted, Jill.
Okay, so I know this is like really, really upsetting, but these past couple weeks, I went from like having a hard time going downstairs to using a cane. Like I'm losing my balance. I almost fell like a couple times, and I can barely walk. So I don't know what to do.
How old is your baby?
5.
Okay, so baby's a little older. Usually in the absence of nothing else going on, things don't progress that quickly. I'm sure that's been incredibly upsetting. And I would encourage you to circle back to your neurologist in terms of evaluation, workup, and what you can do. I really would. I would start there and go from there.
Okay.
Yeah.
I go to UPenn. I see Dr. Lasker.
Okay. All right, perfect. So you're plugged in there, and they have support groups up in Pennsylvania. We have support groups down at Hopkins. Everything is virtual right now still, but eventually we're back in person.
Thank
You
you.
can go to ataxia.org as well and find our support groups. A lot of them are meeting virtually as well, but I do know that I believe there's one in Philadelphia. So
Okay, I'll look into that. Thank you.
thanks for your question. And then Dr. Rosenthal, do you want to go back to a pre-submitted question?
Sure, absolutely. There was a question about, let's see here. Someone asked, I thought this was a good question about how they developed ataxia a year and a half ago, was a specific case in this question. And with cerebellar ataxia, gait got gradually worse. They saw a neurologist, all the results have been negative normal in the workup so far. Advice for what to do next in terms of figuring out the cause of what to do next. The first thing I would do is actually make sure that you have been seen by an ataxia expert. Because the thing is, even if someone does blood work, it's a matter of what they check in the blood. And so if you have 3 things checked in your blood, you really haven't had a full workup yet. So the first thing would be making sure you're seen by an ataxia expert. And the NIF website actually has a list of ataxia centers and neurology specialists, and you can hopefully find one near your house, or these days you might also be able to even do a telemedicine evaluation. So that would be the first step, of making sure that you've been seen by an ataxia expert. The second step then would really be genetic testing in terms of figuring out what's going on. So if you really have had a full workup and all of it's been unremarkable, the next step is genetic testing. I know the NAF is trying to work on a genetic testing initiative. Many insurance companies are now covering genetic testing, and I would encourage you to speak with a genetic counselor and talk to your neurologist about finding a genetic counselor who knows and is knowledgeable in ataxia, because that's really going to be the next step, even if you don't have a family history. And so that's why I think it gets interesting. People assume it's not genetic if they don't have a family history. And what we're actually finding is we're able to identify a genetic cause right now in about 20% of people who don't have a family history. So it's actually it's a very high number that we're able to get. And yes, that means 80% of people were still not able to figure out the cause. So there's absolutely a large group of people that we will never know the answer as to why, at least not right now. But right now we're getting 20% hits on the genetic testing. And I suspect over the next 5 or 10 years, that number is going to grow and grow as we identify more and more genes that we know to be involved in ataxia. So those would be the next steps in terms of workup and evaluation.
Awesome. And then we have hands raised and a bunch of chat questions. So we'll do what we did before, a chat question, then a call on someone. I'm getting Ivig therapy and have been for about 6 months. So far it's working, but I've heard that sometimes it stops working. What do you know about it?
So I assume you're getting the Ivig therapy, at least I'd hope, because you have an autoimmune type of ataxia, and I would assume that's what's happening there. I would say that in my patients who are getting Ivig, there's a couple of things that happen. Insurance sometimes will bulk, even if it's working, and then we have to take a pause, and then people get a little bit worse, and then we're able to go back on it. What I've generally seen, though, is actually more patients stabilizing with the Ivig to slightly getting worse over time. So it's not necessarily that it stops working, but it also doesn't, you still get a little bit worse over time, because essentially the Ivig isn't able to, squash down the autoimmune reaction completely. And that's really, I think, what's happening there. And it's sort of, for the moment, I think the goal would be, continuing with the therapy as long as your doctor and insurance are allowing you, and then arguing with your insurance company to continue to get it approved, and then going from there. But certainly my hope would be that you can do doing the best that you can in terms of continuing to get it and continuing if you and your doctor think it's helping you.
Right. And then Danny was next up, Danny Green for the hand raising. So Danny, I am going to send you the request to unmute yourself.
Okay, can you hear me?
Yep.
My question is for the doctor. What does she know about the BHV 4157 test pill?
Is that the trivilazole?
Yes, ma'am. My wife is going to Burroughs Neurological Institute here in Phoenix, Arizona.
Yep, that's the trivilazole. Okay, there's actually a couple questions about that. So what this is, the BHV actually stands for Biohaven.
Yes, ma'am.
And then the Biohaven 4157 is the name of the molecule or the name of the drug. The generic name is tririluzole, tririluzole, I believe I'm pronouncing it correctly.
Don't get me to pronounce it.
Yeah, no, exactly. We all kind of mess it up a little bit. So essentially it is, let me back up and go through the history here. Biohaven started the original trivilazole study, goodness, a while ago, 3 years, 5 years-ish ago.
2016, I think it was.
Okay, thank you, exactly. So they started the study back then. It was a randomized control trial, which means that some people got study drug and some people got placebo, a sugar pill. And the study was 8 weeks long. And people were at a dose, I believe, of 120 milligrams. But please, if someone can correct me on that, that's fine. But I do know it was 8 weeks, some people on study drug, some people on sugar pill. And then after the study, everyone who wanted to could go on study drug. So there was no more sugar pill. Everyone could go on study drug if they wanted to. What they found when they analyzed those initial 8-week results is that while people who were on the study drug got a little bit better, so did the people who were on the sugar pill. And there wasn't enough of a difference in the people who got better on the study drug and the people who got better on the sugar pill. So everyone got better. The people who got better on the study drug got a little bit better, maybe, than the people on the sugar pill, but it wasn't a significant difference. And so this question has always been, is it really the drug that was making people better? Or is it that they're coming into the clinic and we're giving them lots of attention and we're paying attention and they're thinking about their symptoms and they're exercising and they're going home and they're really, doing everything right for themselves, all of those good things. So they're not really sure. So what Biohaven did though, is they then did what we call a post hoc analysis. So after analysis, and they saw that, well, wait, there seems to be a signal here and it may be real. And it may be that it's not just we're really nice people when you come into research, but rather the drug itself is doing something. So they designed another study. And in this other study, that's now 42 or 48 weeks. So it's a much longer study. And again, though, it's half of the people are on study drug, half of the people are on sugar pill, and it's a higher dose of the study drug. It's a 200 milligram dose.
Exactly. That's
right.
what we got involved in.
Yep, exactly. So half and half. And then again, at the end of this 42, 48 week period, if people want to, they can then continue on the study drug in what we call open label. So everyone knows they're on study drug. Somewhere in the enrollment period for the 42, 48 week study, the time was moving forward and we hit March of 2020. And as everyone knows, a lot of things happened in March of 2020, including the entire world, the entire US shutting down, which included research shutting down. So every single research site basically couldn't enroll patients for at least 2 or 3 months. And at some sites, maybe 5, 6, 7, 8 months, 9 months, 10 months. So the point being, there's been a long delay now. And I believe now we should have the results of the second study. If there's anyone from Biohaven on the call, they can tell for sure. But maybe by the end of this year, early next year, is my understanding.
That's what they're telling her doctor.
Yep.
That sometime in July they will know exactly where she fits into this?
July of this year or
July of next year.
of next year? Okay, right. So it's going to be a while.
She's
Right.
on the extended program right now.
Yes, exactly. So
Taking
to
the
answer
real
your
growth.
larger question, we don't know right now whether or not the study drug is effective. The
Oh.
goal and the hope is that it is, but we don't know. Right now, it is all research, and in an informal poll, I'm a site principal investigator on the study, so I'm involved in the study.
Okay.
Some of us think it's helping, some of us not so much. It varies depending on who you talk to. I will not give you names because I don't want to speak for other people.
Well, I'm talking to you, so what do you think?
I think it might help a little bit.
Okay.
That's my thinking, but I think other people are adamantly saying no, they don't. Other well-respected ataxia physicians I know, I should say, are saying they don't think it helps at all. And also other well-respected ataxia physicians I know are saying absolutely it's helping.
Well,
So this is why we do research studies though, because we don't know. If we knew the answer, it wouldn't be research. For the moment, yeah, go ahead.
She has abdomen problems and tingling of the feet along with blurred vision. Is all this part of ataxia?
Probably part of the ataxia, yeah, not the study drug. So the hope, and we're all hoping that it helps. This is why we do research to find out. And if it is helping, then that's wonderful, and they can push for FDA approval. And if it isn't helping, as disappointing as that will be, with every study we learn something. So
Yes.
with every study we learn, either how to do a better study, which is actually a really important thing that we learn. How to make our study when we're looking at ataxia, how to make it better. So that's number one. Number two, we also learn about the mechanism of action of this study drug and whether or not that's a mechanism that we want to be targeting in ataxia. I saw a question here about a sugar pill. And no, it won't cause diabetes. It's basically just a non-active substance is what they give you for placebo. It won't cause any problems. It won't raise your blood sugar. It won't do anything. It's almost like you're getting water. It does nothing for you. I oftentimes refer to the sugar pill, but it doesn't do anything. It's a placebo. It's a non-active substance.
They got my wife on gabapentin and venlafaxine and pillocarbine.
Yep, those all sound like reasonable things in terms of the numbness and tingling and the depression and everything. Yeah.
Is there anything out there that might help her with her pain in her abdomen and the tingling of the feet?
So to answer that question, the tingling is going to be gabapentin in higher doses. Sometimes we use Lyrica. The abdominal pain I would need to get more into in terms of the relationship of the abdominal pain to eating, bowel movements, activity, and all sorts of stuff. That's going to be a more complicated one to answer. So that's going to be more specific and more detailed.
She's seen every gastrologist here in the East Valley and in Mesa, and they come up with nothing.
So it may not be a GI. Sometimes people have abdominal pain as part of anxiety, but I don't like attributing things to anxiety if you can't find any other cause. There's certainly, bowel movement related, food related. I would start thinking in terms of, cutting out different foods, but that's going to be a lengthier discussion, I think, than what we have time for today, unfortunately.
Okay, well, it's just something that cropped up, and we have two daughters. One of them has the SCA3 hit list.
Yeah.
Is there anything we need to do for her now? Wait.
So the main thing is a couple things. If she is of childbearing age or potential, she should know that there exists in the world pre-implantation genetic diagnosis with in vitro fertilization. So what that basically is they take her egg,
Yes.
the future dad's sperm, put them together on a petri dish or in a test tube. I've never know which one. And then they wait a couple days, and then they test each embryo that they created for the SCA3 gene. And then they only transplant back into future mom the embryos that don't have the gene.
Gotcha.
So what that does is it basically guarantees that your grandchildren will not have SCA3. They don't look at any other genes unless you want them to. It doesn't tell you whether your grandkids are going to have brown hair or blue eyes or be men or women or anything like that. It just the SCA3 gene. So that'd be the main thing that she should know about. So that's number one. The other thing, and I hear this from a lot of my patients, so just I offer this along, is a lot of patients will tell me that they participate in research and they're part of research in order to make things better for their children. And whether or not to participate in research, clearly you and your family are research participants. It's a very personal decision, but that is always the question. That is something else that I hear people doing for their children who have these genes. I see someone ask, what do they do with the embryos that carry the gene? That is a weighted question. There's a number of different places, depending on what type of SCA, that are actually doing research on those embryos. So if that is something that fits in with your belief system and worldview, that is an option. There are also, you can pay to store them forevermore, and you can also pay to have them destroyed. So really, they're whomever created them, the embryos belong to that couple, that person, and there's legal fights over this, and they can decide to either donate them to research, store them, or destroy them, depending on what they want to do.
Okay. Thank you very much.
You're welcome.
Thanks, Danny. Do you want to go to a pre-submitted question?
Sure. So the specific question was asking about Friedreich's ataxia, and the question was slower response time when answering a question or a task, and is that common? And I would like to take that question and broaden it to sort of cerebellar ataxia in general. But to answer the question, yes, that's absolutely common in Friedreich's ataxia, as well as in ataxia in general. We know that the cerebellum does more than we used to think it does. We know the cerebellum obviously is involved in walking and movement, because most of my patients will tell me their balance is off. So we know it's involved in that. We know it's involved in vision and eye movements. And we also are now realizing that it is absolutely involved in psychiatric symptoms, so depression and anxiety, and also absolutely involved in thinking and memory and response time. And there's very specific cognitive changes that we sometimes see in patients who have ataxia. That does not mean that people who have ataxia are necessarily going to have terrible dementia or anything like that. But we do note these cognitive changes, and yes, they are part of the disease.
Awesome. And then I'll go to a chat question next. Can you explain CRISPR? I've heard about it. I've heard that it can help.
So CRISPR is a gene editing thing that can really do some amazing things. I think the details are beyond what I wanted to go into today in terms of how CRISPR works, but it's basically a way of taking out and putting in the genes that you want. And as a concept, yes, it can be amazing. And as a concept, I absolutely think that the CRISPR system and down the line can be incredibly helpful for folks who have ataxia. Right now, there aren't any, CRISPR-related therapies that are available, but down the line, I think it can be very, very cool. And I think it really has you basically go in and you cut the DNA in very specific places, and then you put in the DNA that you want in those places. And you can imagine, as I'm talking about it, that would be really, really cool. But basically, it's we're not quite ready for prime time to use it, but it has some great potential.
We do one more chat question here because we had one hand up, but it looks like it went down. Mike asked, what's the best way to get into a research study?
That is a great question. There's a couple different ways of going about it. The first way is to talk with your ataxia doctor about research studies that are in your area. That's probably the easiest. There's a number of US-based sort of nationwide studies that are ongoing. There's the natural history study, as we call it, that I helped direct along with two of my colleagues. There's also some imaging studies that are sort of nationally based. And then there's also a lot of small studies that are going on. The first thing I would do is talk to your ataxia doctor. That's the first thing, because they can help you in terms of what's in your area. Because some of these studies have funding for travel, but some of them don't. So some of them you have to basically fund your own travel. So you don't really want to be setting yourself up to, if you live in Maryland, fly to California, for example, unless it's something you really, really, really want to do. The next thing you can do is if you go to clinicaltrials.gov, I can write that website in the chat. And if you go to clinicaltrials.gov, and you can basically search for ataxia research studies in your area. What I would do, and what I would really encourage you to do though, because if I run that search on clinicaltrials.gov, you end up with a couple hundred studies. So I would really encourage you to go and talk to your doctor about different studies. And then Sue Hagen also has a really helpful list of research studies that are on the NAF website. And I would actually, those are even easier. I would start with that list before the clinicaltrials.gov list, because I think that would be very helpful. And there's actually, pertaining to the last question, there's a link there about donating affected embryos. And so that's where people can click on in terms of finding out more about donating embryos that have different SCAs. So I would really start by starting with your doctor, this list on the NAF, and then if those aren't effective, going to clinicaltrials.gov. Many research studies have very specific enrollment criteria. Some of them are open to anyone and everyone with ataxia. Some of them are only looking for people with, SCAR 14. And so some of them are very specific, and some of them are looking for anyone and everyone. And so I would start with this list on the NAF website, and you talk to your doctor and go from there.
Great. Did you want to go to a pre-submitted question?
Sure. So what someone asked, and I get this question frequently in clinic, does the number of the gene indicate the severity of your symptoms? So in the question, it was SPG7. But certainly we all know that there's SCA1 and SCA2 and SCA3. What does the number mean? And all it means is SCA1 was the first SCA gene that they identified in research. SCA2 was the second gene that they identified in research. That is all it is. And so it's numbered based on, the first one to identify was the first, and then the second and the third. Last I checked, we're up to like 43-ish SCA genes, at least 7 or 8 SPG7 genes, SPG genes, not SPG7. So basically the number is simply the order in which the gene is identified. It has nothing to do with symptom severity and it has nothing to do with age of onset. It's just the order in which it was identified. That was it.
All right, let's go back to a couple chat questions here. If you have one of the rarer ataxias in your family, how can you encourage research on it? Is there a way to help that along?
That is a great question. And that is really hard. I think I'm hesitating because the way that research is helped along. So first there's the Ataxia Patient Registry. And the reason I think the registry, thank you, Sal, I think the registry is important because it may be that it's not as rare as you think. And so even though it may be rare in terms of SCA 1, 2, or 3, so it's not SCA 1, 2, 3, 6, 7, 8, or 10, which are the ones that tend to come up in the most research studies. if more people start to register on these research registries, we then start to realize, well, wait, maybe there's actually a cohort of patients out here that we can do research on. Because ultimately to do research, it's very difficult to do research on one patient. We need to have a larger group. And there are absolutely some studies that we can take one family's gene and look at it in the mouse model and then go from there. To encourage it along, I would really think in terms of identifying your family, advocating with your doctors. You have to find a champion, and unfortunately, it also requires money. And that's where I think I really hesitate to even comment on that, because it's very difficult to get any research study going without some funding. But certainly, I think knowing that there's a bunch of patients out there who have a certain gene and a certain disease would help researchers like myself know, wait, I'm interested in this topic, but there's enough people here that I could actually do a research study. And so I think that is the main thing, is keep participating in research in order to then help us know that this is a viable research option. And I would also think in terms of, even if we're not doing research on your particular gene, participating in research studies that are looking at ataxia in general and all of the ataxias will in turn help you and people who have your rare disease, because it will allow, understanding the cerebellum and how it works is actually part of researching these rare ataxias. So I would encourage that as well, to really start thinking in those realms of, if there's, if I'm the only one with my gene in the country, how can I help ataxia cerebellar research in general? Because that in turn will help me. And keep in mind also that anything we learn about the more common spinocerebellar ataxias will in turn also help the less common spinocerebellar ataxias. So keep in mind that while it may be disappointing that we're not necessarily working on whatever particular gene someone may have, all of this knowledge about spinocerebellar ataxia will in turn have the potential to help you down the road.
All right, let's look at the next list of questions here. Ted wants to know, can heteroplasmic mitochondrial cause ataxia?
Can what? Hold on, let me find that question and then I can.
Way back towards the beginning.
All right, let's see here. Ken wants to know, where am I looking here? Can say it again? I can't find the question, so say it again.
Heteroplasmic mitochondrial.
Did it come through just to you?
Hmm?
Did it come through just to you? Because I can't find it.
Oh, it's possible. HETEROPLASMIC.
Wait, hold on. HE. Spell it again.
Here, I'll message it to you.
Ah, perfect. Even better. I mean, certainly mitochondria absolutely can be involved in ataxia is the big picture answer to that question. Heteroplasmic mitochondrial. So I imagine yes is the answer, but I think it's heteroplasmic mitochondria. And so the mitochondria has DNA in it. And there are some ataxias that are from mitochondrial DNA changes. And the heteroplasmic, it relates to some of our findings in gene testing. So I'm assuming the answer to that question is yes, it can. And certainly the mitochondria can be involved in ataxia, I believe is where that question's going.
All right. Do you have any more pre-submitted questions?
Yes, let me look here. So someone asked, can only part of my cerebellum be affected? Or can deterioration happen to part of the cerebellum? So is it the whole cerebellum or part of the cerebellum? For people who have the neurodegenerative cerebellar ataxia, so as in people who it's not from a stroke, for example, more often it is the entire cerebellum affected. If you are hanging out with me in clinic or one of your doctors in clinic, you might hear us talking about, oh, based on this exam finding, we know that this part of the cerebellum is more affected than this other part of the cerebellum. So we'll often talk about that in terms of the symptoms that you're having and what we're seeing on exam. And we know that certain parts of the cerebellum are more affected than others. That being said, in the SCA ataxias and multiple system atrophy, and both of those, it really is the whole cerebellum affected, with some of the cerebellum being more impacted in different patients than others. For someone who has a stroke causing their cerebellar ataxia, in their case, it really is one specific part of the cerebellum that is affected. For someone who has cerebellar ataxia from drinking way too much alcohol over many years, more often than not, it is one broad area of the cerebellum that's affected more so than other areas. So there are these sort of areas of the cerebellum that are slightly more impacted than others, but generally in the SCA1s and 2s and 3s and the MSAs, it really is the whole cerebellum that's affected.
All right. Do you have any advice on how to handle dental work when you have swallowing problems?
Oh, that is a great question. You know, amazingly, that's one of the ones I've actually never gotten. And I wonder if I've never gotten it because my patients aren't going to get dental work enough, or if I've never gotten it because they haven't had a problem. And I don't know which one. If you're going, first thing is really to try it and see if there's a dentist that can work with you. That's going to be the first thing. And if there are subsequently problems from there, see what they're able to do. I mean, certainly I have patients with profound swallowing problems, and I have patients with both ataxia and other diseases who have a lot of swallowing problems and are absolutely able to go to the dentist. And I imagine it means a longer dental visit, more breaks, more sitting up, all of those things, a lot more patients on behalf of the dentist. So I imagine all those things, but I haven't actually had a patient say they haven't been able to get dental work because of their swallowing issues, which I don't know if that means my patients need to be going to their dentist more, or if it just dentists are able to figure it out and work with them. And I'm not sure which one, but that's a great question.
Yeah, I hadn't seen that one before.
Yeah.
Anna wants to know, is there anything that can be done to slow the progression of symptoms? I have a baby, so bad symptoms, poor walking, slurred talking, imbalance, plus parenting, plus horrible energy equals a really hard time.
Yes, it would. Okay. The slowing symptoms, right now, there are no medications out there, unfortunately, that can slow or stop the disease. That being said, we do know a couple things. We know that generally patients who exercise do better than those who don't. And, in my mind, circling back to the question at the beginning about the complementary therapies, if I had to decide whether my patients spend time exercising or spend time doing some of these, things that require you to sit for an hour while you stimulate muscles kind of thing, you are much better off exercising. We know the exercise can help. We know it helps build alternative pathways. We know it makes you feel better. We know it helps your mental health. We know it helps your cognition. And so exercise is really the key component to doing everything you can to slow your disease. And that exercise continues throughout the entire disease course. So whether you have mild balance problems or whether you are in a wheelchair, there are still things you can do to move your body, work on your core strength, keep your legs limber, good range of motion. I think being a parent to a young child is an additional incredibly difficult thing to do, because generally when you are a parent to a young child, you are doing your best to keep up with the child, probably not getting enough sleep, which also is going to make things worse in terms of how you feel. And then dealing with sort of the ongoing stressors of being the parent of a young child in the middle of a global pandemic, which is also just magnifying all the problems that we have, because our previous support system for young parents of, getting together with other parents is a lot more difficult now in the setting of the whole global pandemic. Making sure you take time for yourself, making sure you rest, a supportive spouse as possible. If you have funds, I would encourage you to help pay for things that you don't have to do yourself. Housekeeper, even someone to help you cook, that kind of stuff. To really, if there is enough money to help with things like that, that can be very helpful to give you time to rest, put your feet up, get some extra sleep, and exercise. Because that's a really hard combination. And unfortunately, there aren't any easy answers on that one. Because I realize that finding time to exercise when you have a young child is also really, really hard. And so balancing all of that is just a really hard thing to do. But I would really encourage you to try to think about how to structure your life such that the exercise is really as top priority as possible.
Okay. And we have about a minute left. So thank you everyone for joining us. Liana, you can either answer one more question from your pre-submitted or just kind of wrap it up with some closing thoughts or advice, your call.
I think the main closing thought and advice I would have, and this relates to one of the questions that we got, has to do with, so someone wrote that they have strained stamina and they're getting more tired easily. Is this the ataxia? Yes, it is the ataxia. Even getting up and going to grab a water from the fridge takes more energy and more work for someone who has ataxia than someone who doesn't have ataxia. The main thing would be to really work with physical therapy and occupational therapy and thinking through what can you do to reserve your energy. So thinking through, do I need to be standing up while I brush my teeth? Maybe I can sit down. Can I lean up against something while I brush my teeth to save my energy? And then also really trying to think through the exercise component as well. To exercise enough and take naps. Naps are okay. Resting is okay. So you need to sort of find that right balance for you, and that's going to change over time. But it is absolutely the ataxia, and finding that right balance of rest and relaxation and exercise to sort of work with your needs. And I think really the main thing I'd like to add is, while I commented and while we all know there aren't any disease-modifying drugs right now, I am really, really hopeful that in the future there will be. And I'm really hopeful that in the future there'll be even more that we can do to try to slow and stop the disease progression. And thank you all for coming today. I hope it was interesting and informative. And I'm sorry we didn't get a chance to get to everyone's questions.
Yeah, thank you for joining us. Liana, thank you for your time.
Absolutely.
Have a good day, everyone.
Thank you.
Bye-bye.
Have a good week.
I will say the recording will be available within a week at ataxia.org/asktheexpert.
Bye, everyone. Thank you. Have a good
Thank you.
afternoon. Stay safe.